Welcome to the NorthLakes podcast. In this episode, I'll be speaking with chiropractor Claire Tomashek about her work doing dry needling. I didn't know anything about it prior to us speaking, so it was great to learn a lot in not a lot of time. Here we go. Hi, Claire. Thanks for being here.
Yeah, Jeremy. Thanks for having me.
Tell us a little bit about what you do here at NorthLakes.
Yeah, so I'm a chiropractor. I've been with NorthLakes for a year now. We see people from all ages, all walks of life, and help them get them feeling better and out into the
world.
Yeah.
Nice. The reason we're talking today is that you do something in your practice called dry needling.
I do, yeah.
I don't know anything about it. So do you mind if we just start right from the top and tell me what is dry needling?
So dry needling is another therapy modality that we can use to help any sort of musculoskeletal dysfunctions.
Such as decreased range of motion. Maybe someone isn't utilizing a muscle. We need to turn that muscle on. Plantar fasciitis. Just general, we can treat general pain with it. If there's joint pain, if someone has knee pain or shoulder pain, anything really that involves muscles, the ligaments, tendons, the joints, we can pretty much attack that with dry needling. And how does it work? What is it?
So it's similar to acupuncture. We use the same needle. It's a thin filiform or solid needle. We're not, as in with the dry needling, as with acupuncture, dry needling is not injecting anything into the skin or into the tissues. That's part of where the term dry needling comes from. So we don't need to worry about needing a big hollow needle at all. It's a thin filiform.
So a syringe would be wet needling?
Yes, it would.
Oh, okay, all right.
It would, yep. So dry needling, we're not injecting anything into the tissues at all. So because it's a solid needle, it can be nice and small. I'd like to think a little more pleasant than wet needling.
Did I just come up with that? Should I copyright that?
I don't know if. Okay. I think the term has been used.
Today's date is June 27th.
Yeah.
It is 1:08 p.m. Sorry to interrupt.
No, you are fine. Yeah, so similar to acupuncture, and we use the same needles. There's actually quite a bit of crossover between the needle placement as well. With acupuncture, that's rooted in Chinese medicine, looking at meridians and opening up the flow of qi energy. Dry needling was developed under Western medicine as a way to treat musculoskeletal dysfunction. So we tend to look for things like trigger points, general areas, but there's actually been a lot of crossover found between areas that we would look at for trigger points, and that's where we would place the needle for dry needling. That there's a large correlation with the placement of acupuncture needles as well.
So the way it works is that someone has a tight muscle or something, and you're able to take this needle, insert it in a certain way, and it helps to relax that muscle?
Yeah, so
is that am I making it too simple?
That is pretty simple. And it can be that simple. It really depends on what the patient individually, what's going on individually with each patient. So of course we are going to bring the patient in, do a detailed history, figure out what it is that's going on with them. Is it an issue where, muscles are tight and we need them to relax? Is it that a muscle isn't being utilized, isn't turning on, so we need to activate that muscle? Are we just stimulating the healing process?
How do you turn a muscle back on?
So let me think about how I want to answer it.
Sure. Well, I mean, that just sounds pretty, like I didn't know, like if a muscle, how does a muscle work? Does it fire? I mean, so it's not firing? Is that another way to put it?
Yeah. So we're making that connection, that neurological connection. So a lot of people, so everyone, let's talk about glutes.
Sure. Yeah.
So everyone has glutes, but not everyone utilizes those glutes, or not everyone activates their glutes. Actually, a lot of people do not know how to activate their glutes. So that's a pretty common muscle that we would look at being able to turn on or activate. And it all depends on how long we have the needles in those muscles, or if we do any sort of manipulation of the needles. And activation of a muscle turns into fatigue of a muscle. So generally, we would have the needles inserted for a shorter amount of time to activate a muscle, and then we would increase that treatment time if we were looking to fatigue a muscle. A lot of people have overactive quadriceps, and that's a pretty common lower cross syndrome. Weak glutes that aren't turning on, quads that are tight and are overactive. So that's two great examples of one muscle group that we would look at activating, using dry needling to activate, and then a different muscle group being the quads that we would look to fatigue those muscles and allow some of that workload then to be distributed to some of the other muscles that should be working more.
What do you mean to fatigue it? What does that mean?
So essentially, if we want to say it simply, we're turning that muscle off. We're fatiguing it. Same thing if you were to go exercise that muscle a lot, you would fatigue it. So then it wouldn't be able to fire as much, or it wouldn't be readily available to use as much. So we're fatiguing that muscle. We're making it tired, essentially, so that we are putting the responsibility of muscles onto other muscles.
So
that
you
probably could have been said better.
Oh, well, I think I understand.
Okay.
So you're kind of wearing it out, so another muscle's taking that load. Mm-hmm. Okay. Why is that important? Yeah.
So we have some muscles that we overly utilize, and they take the brunt of the responsibility for certain movements that we do. Well, over time, that's going to lead to issues in that muscle that's being overworked. And our muscles are all connected to our joints, so it's going to affect how the joints function as well. We want to obviously be taking care of our joints and balancing that load out a little better.
And which is good, because you don't want to, if you're overusing one,
you're underusing another
one. And it's like, so why is it good for me to use all of the muscles? Why would that be bad if I'm walking on one foot?
Balance is always a good thing.
I agree. I just I wonder if there's just a scientific answer to that.
Mm-hmm. Well, for that, I would say balance just leads to better function. We want to make sure that there's equal usage, equal tone, equal strength to balance out. Because while one muscle is being worked, the other is relaxed, and vice versa.
So one kind of thing, I don't know if this is a good example, that I think if someone is bedridden, mm-hmm. I've heard that they get, and I don't know, I'm a podcast guy, so I'm not a scientist, or a doctor, but but I watch TV. Mm-hmm. So I'm like, we have to move them around. They need to be moved. Is that how would that apply to what we're talking about right now? That someone who's kind of not moving, they still need to have their muscles mm-hmm. moved.
Yeah. So that's a great example of the concept of use it or lose it sort of thing. So same thing when you asked, why do we want to make sure the muscles are balanced? If we're underutilizing one muscle, then those muscles are never getting activated. Those muscle fibers are never getting activated and utilized. So it can lead to more atrophy of the muscle, weakness of the muscle, and lead to problems down the road.
Got it. So sorry, we went down a little bit of a muscle rabbit hole. I kind of forgot we were talking about dry needling.
They are part of the musculoskeletal system, and
yes.
That's what we treat with dry needling. So.
Excellent. And do you know, you touched on this just a little bit, like how did somebody figure out, hey, if we put this needle in somebody, that makes this muscle do this? Or do you know the origins of
that's
this?
A great question, and I don't know. I know that dry needling was developed under the Western medicine umbrella And I'm assuming coming then from the history of acupuncture and the strong history of that.
So they're related but different.
They're related but different, yes. Yeah, acupuncture was certainly first.
Right. So how are you able, and I don't think there's many chiropractors here at NorthLakes that use this. I think there's you and maybe one other.
Yep, myself and Dr. Adam in Lakewood.
Okay. Well, how did you get interested in it?
So I've always been surrounded by athletics. I was always very involved in athletics growing up and wanted to always perform well, always be healthy. Those are important things for athletes. And I want to continue to be able to now provide great care for not only the athletic population who wants to focus on performance and staying healthy and being able to play, but just if we can help people have a higher quality of life in their everyday life, that makes a huge difference in someone's life.
And how does it interact with your chiropractic practice? Does it mean like you're doing chiropractic care or dry needling, or is it all kind of you put it all together and make one nice package?
So again, it's very much so on an individualized basis. A lot of my patients, I utilize both the chiropractic adjustments as well as dry needling.
It's just would you say it's just another kind of tool in your toolbox?
It is, absolutely.
Mm-hmm. And when you bring it up with people, I'm going to guess that some people are like, "You're going to do what?"
I have gotten that reaction.
How do you kind of introduce it, or what are people skeptical about it?
Yeah, so some patients that I treat with dry needling have had experience with acupuncture in the past, or have even had dry needling performed by another provider, and they, of course, are a lot more familiar with what that treatment is going to be like. Someone who's brand new has not had any experience with acupuncture or dry needling, we certainly take a few appointments to talk about it. And I always introduce dry needling as an option as I get to know that patient and their individual case. If I think that dry needling would be helpful, I, of course, bring the topic up, not in any sort of pushy way, but just as hey, this is another service or another tool that we can utilize in your treatment plan. I think it would be beneficial for X, Y, and Z. Talk about what the treatment process would look like. And if they are on board to do it, then we go ahead and we try that and see how they respond. If they're like, needles aren't my thing, then that's okay too. We have, like you said, other tools in our toolbox to use.
But for the right person, it might be the right thing.
Mm-hmm, absolutely.
And I wish I could be a fly on the wall when you're having that conversation. Yeah. I mean, you must get a variety of reactions.
I do. Most people have, though, been very, very open to it. And people are coming to us in pain or for some variety of symptoms that they want gone. So a lot of people are very open to trying any sort of treatment that's going to help.
And they know you and trust you, so
Yep.
Like, why would they give it a try?
No, you trust you like you, and yeah, we're good to go.
And how does that first session go? Like, I don't know why I thought of this, but I've never gotten a tattoo. But I think I just like
either.
Well, but I'm always curious of like, what's that feel like?
Yeah.
So when you're introducing dry needling, how do you make somebody feel comfortable? Like, here I go. I mean, is it? Mm-hmm. How do you how do you kind of like set the tone? Yeah.
So I explain first and foremost what we're going to do, what the treatment is going to be like. You're going to be laying in this position or sitting in this position. These are the areas that we're looking to insert needles into. You're going to feel that initial prick of the needle when it pierces the skin. You're also going to feel the needle as it's being inserted. So general rule, anytime the needle is moving is when patients can feel the needle. If it's just sitting there, once we have it inserted and I leave it, don't touch it, then they don't feel it. So I like to explain that to them. You'll feel that initial prick. You'll feel as I'm inserting it, then I won't move it at all, and then you shouldn't feel anything. That first appointment for dry needling, I get all the needles in place and I just let them sit. So we can do different manipulations of the needles while they're inserted, whether it's a pistoning technique or winding or fanning, different technique terminology. But for the first appointment, I just let them sit and we see how things respond. So I don't want to do too much right away because not everyone responds well to dry needling. A majority do, but I like to give that first appointment to just have a very generalized understanding of what is the treatment process going to be like, and is this something that I feel better after, that I feel was of benefit to me. If they come back after their first appointment and they say, yeah, I think that it helped, then we'll look to do more sessions.
And I like those descriptions. I think I know what they mean, but it was pistoning and winding.
Yep.
And I'm doing these motions with my finger.
You got it. Perfect. You could probably do the dry needling.
Come for the podcast. Stay for the dry needling.
Yeah.
I don't think anyone would want. Thank you for the compliment. You got me to snort. That's good. So I guess you did kind of answer this, but it's not like where I'd say a shot where I'm getting a tetanus shot, like in and out. Like you place the needle, it's left in for a little bit.
Most times, yes, unless we're working in a joint space, then it would be insert the needle into that joint space, likely utilizing that piston technique, and then that needle comes out. We discard that one. We might do a few needles like that in the joint space, but each one goes in and comes out.
So when you say discard, I have so many questions. I'm just going to jump all over the place here. But one of them is, so you don't reuse these? You don't have a set of needles, like these are Claire's needles? Nope. They're like a disposable, like a tongue depressor or a syringe?
Yep, so it's a single use, so sanitized single use needle. So we don't use the same needle twice between patients, different patients. That would be very concerning. But we also don't use the same needle twice with the same patient. I don't insert it in one spot, take it out, insert it in a new spot. It's single use. It goes in. As soon as it comes out, it goes into a sharps container.
Okay. And how far are you inserting it, or can it go in, or do you go deep, or I guess it depends on a lot of things.
It all depends. Yep. So main thing when determining length of needle, first and foremost, it's based on safety. So there are some areas that if we were to needle and go too deep, that you could hit the lungs or a kidney, or there are obvious structures that we don't want to be sticking a needle into. So first and foremost, we look at safety for when picking the needle length. We then look at body region or the structures. So are we looking to hit a superficial muscle that's right on the surface where we maybe don't need as long of a needle, or are we looking to hit a deeper structure where we would need a longer needle because we're going through a couple other muscle layers to get to that needle? Then third would be patient size. So if there is a smaller patient who doesn't have a lot for muscle mass, we would certainly look at using a shorter needle than if I were to be needling a 250-pound person who has quite a bit more muscle and body mass.
And so many. I want to after this, I want to come and see the needles.
We can go downstairs.
Okay, all right,
you can take a look at them.
All right, okay, that sounds good. And so, what is happening? So the needle enters the muscle, and you're pistoning it, or winding.
Yep.
So what's going on? What's it doing?
So in For a simple explanation of that, it would be...
Simple's perfect.
Yeah, okay. So a simple explanation is we're sticking those needles into the tissue and we are creating a micro trauma or a tiny lesion. But the body responds to that micro trauma as it would any other trauma. So we're stimulating the healing process. We're causing vasodilation. We're bringing, which is caused by a pathway of hormones that are stimulated. We're also drawing blood to that area that's going to stimulate the healing process.
Are there moments when you are performing this that you do a move, insert a needle, and you can feel the muscle react? Like, yeah,
so
I got it.
We can get what's called a localized twitch response. And that is typically, you can get it just on the insertion of the needle, but it's more common when you're using the pistoning technique to initiate a localized twitch response. That's thought to result in a greater outcome of results, but it's not needed for the dry needling session or therapy to be effective.
What would be effective? What would be some of those long-term effects?
So typically right after the session, we see an increased range of motion and can even have increased strength in that muscle. Also decreased pain. And again, going back to different techniques with manipulating the needles or how long we let the needles sit in the tissues can affect if we have a greater decreased pain sensation outcome.
Okay. And when you're talking about size of needles, here's one of the questions I wrote. I'll just kind of read it because I do children receive dry needling?
They can. So a common guideline is to not really look at needling anyone under the age of 12 because most times they're going to be more afraid of that treatment than it would be beneficial. So we, of course, don't want to be traumatizing any of our patients. That would certainly not be good. But yeah, I would say kind of around that 12 years of age, we could look at utilizing dry needling more.
And is there the question I wrote, and I don't know why I went this way, is there like a kid size needle? And what this came from, I guess, is like...
necessarily kid size,
right.
But you would use, depending again on safety, region, and patient size, you would look to determine the length of the needle. But they do have needles that are kind of designed for children where they have a round, flat patch that lays on the skin, and then the needle is inserted in the middle of that patch. So if we want to get a little sciencey, that surface level stimulation on the skin travels quicker to the brain than that needle being inserted deeper. So that patch that lays flat on their skin kind of tricks the brain a little bit to, hey, pay attention to me on the surface of the skin, not on this needle being inserted.
Oh, more tricks.
Yeah.
And do people, and you kind of touched on this a little bit, do people typically lay down? Are they sitting down? Are they standing? Or again, depends on what you're trying to do. So
main factor in determining what position the patient is going to be in when we're dry needling them is what structures are we going to be needling. So are they laying on their side? So oftentimes we would have them laying. So are they laying on their back? Are they laying on their stomach? Are they laying on their side?
So depends.
Depends.
Yes,
yep.
Right. Got
Depends.
it. So there's not a straight, you're always laying down. It's
always laying down. Yep. And so typically patients right after they'll experience the range of motion, an increase of range of motion that I touched on before, they can also feel some soreness. So I like to tell people, as an example, if I were to needle your calf, it's going to feel like you just did 100 or 200 calf raises, like that muscle soreness, because we did get into those tissues and
fatigue it.
And fatigue it. There you go. Yeah. So you can feel some soreness in the area that should go away later in the day, within a day or so. There can be some bleeding at the insertion site, just a little spot of blood when the needle is removed. If that happens, we'll just take a little cotton ball, wipe that up, and dispose of that. Just a little droplet of blood. You could have bruising at the insertion site as well, which again is something that will go away. Just nothing major, but can happen with some patients. And then the importance of having patients lay down during their treatment is some people have what's called a vasovagal response. And our vagus nerve is responsible for some of the vessels, vasoconstriction, vasodilation, how much blood is going to an area or not. And stimulating that vagus nerve, we can stimulate that nerve with this dry needling, or if someone is already in a lot of pain, if someone is in a lot of pain or their nervous system is already very heightened, we're lowering the threshold. And so they can more easily have that vasovagal response, which could lead to someone feeling lightheaded, even potentially nauseous, or as if they're going to faint. So that's the importance of having them laying down, so that if they were to start feeling any of those symptoms, we don't have to worry about someone falling off of a chair or...
Sure. So you're kind of thinking down the road a little bit, like we're going to take care of you through and through.
Yep. So I always let patients know beforehand that those are possibilities. And to certainly, if they start to feel any of those symptoms, let me know during the treatment. We'll remove the needles, give them a little bit of time to catch their bearings again. And it's not a bad thing. It doesn't mean that dry needling is not a good treatment option for you. It's just something that can happen with some patients.
It's a side effect. And is it kind of a one treatment and done, or people will come often, or?
It depends what's going on symptomatically, what's going on, in the rest of the body is, so some people, if it's a more acute issue, we likely are going to see them a few times to dry needle. Some people do just want to come in and try it once and see how things go. Maybe they got great relief and they want to see how long that relief lasts. But typically we would see someone more than once.
But I suppose if you're like me, I'm a kind of an office worker that I sit down a lot. And so I'm sitting down all the time. I might want to come in a few times a year to kind of get tuned up. And with the needles, are there, do you ever have to get special needles because someone might be allergic to what you're using? Yep.
So actually one contraindication to using dry needling would be a metal allergy. They do make certain needles that are gold plated. So if you do have that allergy or sensitivity, we can use some fancy needles on you that are gold plated.
Right. Nice. And they are called needles. Is there another term? Like there's no special
not that I know
secret term that you doctors use?
No.
Okay. All right.
Just needles.
Okay, good. Are there common places that needles are inserted?
Again, it's going to be on an individualized basis. There are common points or areas to hit for similar symptoms. If someone comes in with tennis elbow, we're going to be looking at hitting some of those same structures as someone else who comes in with tennis elbow. So we treat at the localized, or we treat at the local level. So if someone is having elbow pain or knee pain, we're going to treat that area itself, but we're also going to look above and below the treatment area as a way to have a bigger effect or a more broad effect, because those joints or that area of symptoms can be affected above and below from the tissues above and below as well.
Got it. But like if somebody's coming in so the same person, different people would have similar insertion points if their knee was in trouble, but like not everybody's
we could go on a whole
Sure. Okay. All right.
a whole laundry list of things wrong with the knee. But yeah, if they're coming in for a similar problem, we would have maybe some of the same areas right around the knee, and then we would look at similar muscle groups, but it's probably going to be different spots in those muscles that are being needled. Got it.
But not every single person that you dry needle is going to get a needle in point X. You don't always. Okay.
No.
All right. What are some common ailments that you're able to help with dry needling?
So really anything that involves the musculoskeletal system. So we can utilize dry needling with muscle strains, ligament sprains, injuries to the joints. We can do generalized pain. We can attack chronic pain with it, plantar fasciitis if there's osteoarthritis in a knee. So there's a very broad spectrum of symptoms or conditions that we can treat with dry needling. So in dry needling, we're addressing the musculoskeletal system, so we can insert needles into really anything that relates to that. So into the muscles, into their tendons, into ligaments, into joint spaces.
So is there anyone who should not receive dry needling? Is receive the right word? Is that the good way to put it? Okay, good. All right. Is there anyone who should not receive dry needling?
There are a list of contraindications to utilizing dry needling. You had touched on one before, which was a metal allergy. We certainly wouldn't want to be introducing that to the body. Other things would be cancerous tissue. We don't want to be dry needling cancerous tissue. Pregnant patients. If someone is pregnant, then they are out for the time being on dry needling.
Why? I can think of obvious answers, but why not?
So for more in acupuncture, I don't know if you've ever seen. There's a spot on the hand, on the foot, and on the ear that are all associated with. So there's a spot on the hand that's associated with every other place in the body, and same with the foot and the ear. And so there are areas then that are linked to reproductive organs and that. And without the knowledge of those, needling those, if you didn't for sure know that you were avoiding those areas, can lead to either spontaneous abortion, which we certainly don't want, as well as triggering labor, which, again, if it's not the right time, it's not the right time for that.
Sounds like a good reason to wait. Okay.
Yeah. So pregnancy, any systemic diseases or immunocompromising diseases, we want to stay away from. Any systemic conditions or like blood cancers, like leukemia, things like that. And we will go through a detailed history before anyone were to be dry needled. So we would find any of those contraindications or precautions as well. Things like diabetic patients. Dry needling can alter how blood glucose is metabolized. So that's a precaution. Dry needling is a precaution with diabetic patients, as well as if we were to have bloodborne pathogens and other things like that. And there's a list of them, but that's off the top of my head what I can
Sure,
right
but
now.
Like there's definitely and that's why you do the screening to make sure you don't, it's not a bad thing. Mm-hmm. You want it to be a good thing.
Yep.
And so anything else about, afterwards, sessions over, what someone can expect? You kind of touched on a little bit of like maybe some soreness and bruising. Mm-hmm. Anything else?
Yeah. So after, we like to ask the patient, do you feel better, same, worse? Some instantly say, yes, there's less pain there. or the tissues feel looser. So we touched on that increased range of motion, can have some soreness that should go away, later into the day. Then typically I like to tell patients that, especially if this is their first time being dry needled, again, I like to explain the treatment itself, but then typically you're going to know within 24 hours of if dry needling is going to be of benefit to you or not. You'll be able to say, yes, I feel better. This knee feels better, or so on. One thing then with that increased range of motion, we want to make sure that patients are stretching after. So we gained that increased range of motion. We want to utilize it and incorporate it into our everyday range of motion. So I always tell patients, make sure that you stretch after, potentially do some exercises to then engage those muscles. Certainly increase your water intake. We want to make sure that we're staying hydrated, and that's important after a dry needling session. And one other thing that I like to touch on with patients is, so we did create little tiny holes in the skin, so we don't want to put lotion or sunscreen, or certainly not biofreeze, that wouldn't feel very good, or icy hot Tiger Balm, anything like that. So there are little holes in the skin from where we inserted and removed the needle. So for that next day, we don't want to introduce any of those potential irritants to those areas that we needled.
Got it. Be careful with hot peppers.
Mm-hmm. Yeah.
Someone who's doing dry needling, they need to do their own kind of work afterwards. Like, sure, you've kind of gotten things, rolling again, maybe gotten that muscle in a better spot, but it's not like a one and done kind of thing. Your patient should expect to do a little homework.
Exactly.
Afterwards.
Yeah. So we do our best to utilize dry needling as a way to remove some of that dysfunction. But if nothing changes after that, then that dysfunction can return again. So if we worked to loosen up a tight muscle, we still want to stretch to continue to have that range of motion. If we worked on activating a muscle, we'll go back to the glutes. I like the glutes. If we utilize dry needling as a way to activate the glutes, we then want to perform exercises to then be able to readily utilize and activate the glutes ourselves, so that we're not relying on dry needling. We can use dry needling as a way to activate those muscles and turn those muscles on and kind of give us that
jump start.
A little jump start to being able to activate those muscles, but ultimately then we need to continue to use them.
Claire, what about if someone has just recently been injured? I don't know, like a broken bone or something like that. Is dry needling, can you use it for that? Or I don't know, when in that kind of situation would it be good or bad? Yeah,
so we would stay away from fractures, but if someone had, say, a pulled muscle or an ankle sprain, or an acute injury to the back where it's new symptoms, we can utilize dry needling as, again, a booster in the healing process, because again, we're creating those micro traumas. The body is responding to those micro traumas the same way that it would trauma to any extent. So we're stimulating the healing process, bringing more blood to that area, getting things going. So dry needling is a great way to kickstart and enhance the healing process for acute injuries or muscle strains, things like that. But it can also be used with chronic issues as well, because we can, instead of boosting the healing process that's already starting with acute injuries, we can help restart the healing process with chronic injuries. So some people, we see that we have made progress with their chronic pain, and then they just kind of plateau out and they're not getting any better. So we can utilize dry needling as a way to introduce those traumas and restart the healing process.
Wow.
Yeah, so it's really neat to see how many different situations dry needling can come into play and be helpful with.
Do you love this work?
I do.
I bet. It's just got to be fascinating. Thank you. What kind of licensing did you need to get, if any, to practice dry needling?
Yeah, the state has certain courses provided through these accredited entities that are accepted in the state, and it's different per state in terms of dry needling and who can perform dry needling and how much education do you need and things like that. But so I took mine through, I took my course through an entity that was okayed by the state of Wisconsin. So,
and it ties in, insurance and Medicaid way, that it's not any different than your chiropractic practice. It's just another, as we said earlier, tool in your toolbox. It's not a special designation or anything.
So it is billed differently. It gets billed specifically for dry needling, as with any of so it kind of falls more under modality. So our adjustments are adjustments. And then any sort of modality that we use, whether it's dry needling, electrical muscle stimulation, traction, those fall under modalities, and they each kind of have their own billing. And so it's different with every insurance company. The best option would be to call your specific insurance provider and ask them what do they cover and what do they not. Hey, if I went to get dry needled, would that be covered?
But it's not a real outlier. Like you just named a few other things that are similar, so it's not like its own special.
Yeah, and it is becoming more popular for some insurance companies to cover dry needling.
Well, Claire, this has been great, and I'm going to try your last name again. I'm sorry. Here I go. Tomashek. Tomashek. I'm sorry, Claire. Pardon me.
It's okay.
Claire, I've got one last question for you. What's in your car right now?
I believe I have my paddleboard and a hammock in there.
Perfect. Nobody yet has ever said spare tire.
I'm sure it's in there somewhere.
Got it.
Tomashek, yep.
Claire Tomashek, thank you so much for speaking with me and being on the NorthLakes podcast. I really learned a lot, and I really appreciate your time. Thank you.
Yeah, of course. I'm happy to be here. I'm glad you asked me to do this.
Okay, I'll talk to you soon.
Yep.
Bye.
Bye.
I've said it once, but I'm going to say it again. I'm so lucky to be the one having these conversations on the NorthLakes podcast. I feel like I learned so much, and I hope that you feel the same way. Thank you, Claire Tomashek, for sharing so much. It was wonderful to talk to you. Claire is a chiropractor at our Park Falls Clinic, one of the several NorthLakes clinics that offer chiropractic services. Go to our website, nlccwi.org, to see which location is closest to you, and then give us a call. We would love to hear from you. The NorthLakes podcast is produced by NorthLakes Community Clinic, a community health center with locations throughout the north part of Wisconsin. Our mission is to respond to the healthcare needs of our communities with an integrated array of quality services and actively remove barriers to wellness. My name is Jeremy Oswald, and I am a marketing and communications specialist at NorthLakes. Please share a review for us wherever you are listening. It helps other people find the show, and that is a good thing. We will have another episode next month. See you then, and thank you for listening.